There are about 1,200 RN vacancies within the state. That number is projected to grow past 5,000 within 2030. About half of Alaska Natives live in rural villages that are not accessible by the road system.
We had a lot of travel nurses at our facility. It was quite a shock, I think, to them culturally.
In places where you have a transient medical population, they don't really fully comprehend the challenges that the community members are facing.
The idea that you had to fly in to have a baby was kind of daunting.
Research has shown that if we grow our own nurses, right, they're more likely to stay within the state, go back to their communities, and support their communities.
RRANN is recruitment and retention of Alaska Natives into nursing. It's a support to make sure that Native students are successful in the nursing program. They provide scholarships, workshops.
It's like having a little bit like a big brother or big sister that can kind of show you the ropes.
Coming from a village to Anchorage is a really big change, and so having people that understand where you're coming from and understand what resources you will need, it makes you feel less isolated because you have other Native people with you and in your corner and supporting you.
I had my daughter in the first semester, and they provided a safe place to breastfeed. Any kind of mentorship and support, I really appreciate it.
It's making nursing and nursing school so much more accessible for Alaska Natives.
From 2019 to 2022, the state cut funding to the university of $55 million. We had to rebuild the student population. With Premera giving us funding, that allowed us to continue to travel to these places, meet with students, and recruit.
Bethel is the hub for over 50 villages, a region that's about the size of the state of Oregon.
The funding from Premera will be used to build a brand new lab for our nursing students here.
They offered me a scholarship, and I used that to pay for my books and my equipment for school, as well as internet.
A lot of the students right now, they want to stay in region. I've had students who want to become nurse practitioners, who want to train health aides, who live in the villages and work directly with patients out there.
I know that a lot of Native elders like working with Native people because of familiarity and a comfort, and even having the same language.
I work with a lot of nurses that are Alaska Native, and that's really encouraging because I just see more of those faces.
I can be an example to younger kids. You can get out there and help people.
I've had a lot of people reach out to me and ask me how I did it, or mention that they started the nursing program because they saw that I was doing it and thought that they could do it too.
That gives me a lot of pride and sort of that reassurance that my culture, people of Alaska, or Alaska Native culture, will continue to thrive.